The story of dogs begins long before pampered pups and pedigree breeds. It starts in the harsh, unforgiving landscape of the Ice Age over 20,000 years ago. Wolves, our canine companions' ancestors, roamed these frozen wastelands. They were skilled hunters, working together in packs to bring down prey much larger than themselves. Humans, too, struggled for survival in this challenging environment. They hunted for food and sought shelter from the bitter cold. It was in this challenging context that the paths of humans and wolves first intertwined. Drawn by the scent of human encampments and discarded food scraps, some wolves ventured closer. This tentative interaction marked the beginning of a remarkable partnership. Wolves, with their keen senses and hunting prowess, offered protection and assistance in tracking game. Humans, in turn, provided a stable source of food and a degree of safety. This mutually beneficial relationship, forged in the crucible of the Ice Age, laid the foundation for the domestication of dogs. Over time, the wolves that continued to associate with humans evolved. They became more tolerant of human presence and eventually diverged from their wild counterparts. This marked the birth of a new species, the domestic dog. The transformation from wolf to dog did not happen overnight. It unfolded gradually over thousands of years, driven by a process called selective breeding. Humans began to intentionally breed dogs with desirable traits. Dogs that excelled at hunting, herding, or guarding were favored. Their offspring inherited these valuable characteristics, reinforcing the traits over generations. This controlled breeding led to the remarkable diversity we see in dog breeds today. Each breed was sculpted by human needs and preferences. Hounds, with their exceptional speed and sense of smell, were bred for hunting. Shepherd dogs, known for their intelligence and herding instincts, were invaluable in managing livestock. As human societies evolved, so too did the roles of dogs. Smaller breeds, bred for companionship, emerged as cherished members of the family unit. The process of selective breeding, while instrumental in shaping the canine world, had unintended consequences. By focusing on specific traits, breeders inadvertently amplified certain genetic predispositions. This has led to a range of health issues that plague many modern dog breeds. The quest for breed standards, a set of idealized physical characteristics, has come at a cost. By emphasizing specific traits like short snouts, wrinkles, or dwarfism, breeders have unintentionally increased the risk of various health problems in purebred dogs. One of the most prevalent issues is brachycephalic obstructive airway syndrome, or BOAS. This condition affects breeds with short, flat faces like bulldogs, French bulldogs, and pugs. Their compressed facial bones restrict airflow, making it difficult for them to breathe normally. Other health concerns include hip dysplasia, a painful condition affecting the hip joint, common in larger breeds. Eye problems, such as cataracts and progressive retinal atrophy, can lead to blindness and affect a wide range of breeds. Skin allergies, ear infections, and joint problems are also common complaints. These health issues highlight the unintended consequences of selective breeding. The pursuit of aesthetic ideals has in many cases compromised the well-being of our canine companions. The pug, with its wrinkled face, curly tail, and compact body, has captured the hearts of many. However, this breed serves as a stark example of the health problems that can arise from selective breeding. Pugs belong to the brachycephalic category. Their shortened snouts, a result of generations of breeding for a flat face, severely restrict their airways. They often snort, wheeze, and struggle to breathe, especially in hot weather. Their bulging eyes are prone to injury and infection. Their wrinkled skin is a breeding ground for bacteria, leading to skin fold dermatitis. Beyond these issues, pugs are also susceptible to obesity, spinal problems, and eye conditions. Their quality of life is often compromised by these health challenges, leading to veterinary interventions, discomfort, and a shortened lifespan. The plight of the pug underscores the importance of considering health implications before aesthetics when breeding dogs. Section 5. Beyond the pug health concerns across breeds. While the pug serves as a poignant example, health issues related to selective breeding extend far beyond a single breed. German Shepherds, beloved for their intelligence and loyalty, are prone to hip and elbow dysplasia. Dachshunds, with their elongated bodies and short legs, are susceptible to intervertebral disc disease, a painful condition affecting their spine. Golden retrievers, often considered the quintessential family dog, have a heartbreaking predisposition to cancer. Boxers are at increased risk for heart conditions and certain types of cancer. These examples highlight the widespread nature of health concerns in purebred dogs, a direct consequence of selective breeding practices. Section 6. The ethics of breeding. Where do we draw the line? The pursuit of breed standards has raised significant ethical concerns regarding animal welfare. Is it ethical to perpetuate breeds that suffer from debilitating health conditions? At what point does our desire for a certain aesthetic cross the line into animal cruelty? Breeding dogs with known health problems raises questions about our responsibilities as guardians of these animals. Are we prioritizing their well-being or our own preferences for a particular look? The growing awareness of these ethical dilemmas has sparked a movement towards responsible breeding practices. Section 7. A call for change prioritizing health over aesthetics. The time has come to shift our focus from aesthetics to the well-being of dogs. Responsible breeders are leading the way, prioritizing health testing, genetic diversity, and ethical breeding practices. They are working to reduce the incidence of genetic diseases and improve the overall health of dog breeds. Education is crucial in this endeavor. Potential dog owners must be made aware of the health risks associated with certain breeds. Section 8. Responsible breeding, a step in the right direction. Responsible breeders play a crucial role in improving the lives of dogs. They prioritize the health and temperament of their breeding animals above all else. They conduct thorough health screenings to identify potential genetic issues. They choose breeding pairs carefully to minimize the risk of passing on hereditary conditions. They adhere to ethical guidelines and prioritize the well-being of their animals over profit. By supporting responsible breeders, we can contribute to a healthier future for our canine companions. Section 9. Our canine companions, guardianship, not ownership. Dogs have been our companions for thousands of years. They have earned a place of honor in our homes and hearts. As we move forward, it is essential to view ourselves not as owners but as guardians of these remarkable creatures. We have a responsibility to prioritize their well-being, to protect them from harm, and to make choices that benefit them, even if it means challenging long-held traditions. Let us choose to be guardians of their health, advocates for their well-being, and champions for a future where every dog can thrive.